Hey guys, this is a session on the drugs acting on the central nervous system. This is the main unit, and the subunit is the neurotransmitters and the central nervous system. So, we know what are the neurotransmitters. Generally, these are the chemical substances, which are responsible for the transmission of the impulse through the synapse. These are nothing but a chemical substances which is released at the nerve fiber. As you can see, these are the vesicles, synaptic vesicles present in the presynaptic neuron. We have already studied these basics in the physiology, and this is the postsynaptic neuron. This is the presynaptic neuron. So in this presynaptic neuron, there are vesicles, various vesicles, which comes at the nerve terminal to release the neurotransmitters present within these vesicles. So a chemical substance which is released at the end of the nerve fiber. This is a nerve fiber and this is another nerve fiber. So, and this is the synapse. This is the synapse or the synaptic junction present here. This is a synaptic junction present here. So when these neurotransmitters gets released in this synaptic junction, they diffuse to the other postsynaptic neuron through these receptors present in them, postsynaptic receptors. So they usually transfer the impulse from one nerve fiber to another nerve fiber. This is the general definition of neurotransmitters. So that's what you can see in this diagram. This is the presynaptic neuron and this is the postsynaptic neuron where the impulse is getting transmitted from the presynaptic neuron. You can take it as excitatory neurotransmitters, there are inhibitory neurotransmitters, there are also mixed neurotransmitters. We'll be speaking about them in detail. So the heading is the neurotransmitter and the central nervous system. We know that usually there are three types of neurotransmitters. Inhibitory neurotransmitter, which usually inhibits the effects. Second one is excitatory neurotransmitter, which increases the effect at the nerve terminal. And the third one is the mixed one, which shows both inhibitory effect as well as the excitatory effects. The inhibitory neurotransmitters mainly includes the GABA, glycine, and dopamine, which mainly shows the inhibitory effect on the central nervous system. The second one is the glutamate and the aspartate, which mainly shows the positive or stimulatory effect on the central nervous system. Whereas the third one is mixed, that shows both inhibitory and excitatory effect, which mainly includes the acetylcholine, noradrenaline, and 5-HT, that is 5-hydroxy tyramine, that's serotonin, which these three mainly shows both inhibitory and excitatory effects. Therefore, they are not usually prescribed as medicines because we can't tell which action it shows particularly. It might show inhibitory effect, it might show excitatory effect. So we usually advise the patient with the inhibitory effect drugs or the excitatory effect drugs. These are not usually prescribed. Sorry. So, moving on to the inhibitory postsynaptic potential. So, what is inhibitory postsynaptic potential and excitatory postsynaptic potential? We have already learned in the synaptic transmission of the physiology lecture. Inhibitory postsynaptic potential, just giving the basic touch. So, the when the inhibitory transmitter binds and interacts with the specific receptors on the postjunctional membrane, the membrane's permeability to potassium or chloride increases. It's an easier one. So, chloride is an anion. This is the presynaptic nerve terminal, and this is the postsynaptic nerve terminal. So, when the neurotransmitters are released, mainly that time, if you have a inhibitory neurotransmitter, then the potassium inside present the postsynaptic neuron will start to move outside the neuron, and therefore the positive charge outside increases. the positive charge outside increases. Whereas the second is the anion chloride, since it's coming inside. So inside the neuron, the negative charge increases. Outside, the positive charge increases because potassium is going extracellular, and inside, the chloride ion increases because inside there is a negative charged ions. So this leads to a condition of hyperpolarization. It leads to hyperpolarization condition, which is mainly seen in the inhibitory postsynaptic potential. This tells about the inhibitory postsynaptic potential. If you move on to the second one, that's the excitatory case, same but the opposite one. So here when the potassium is moving outside, we know it's showing the positive effect because potassium is a cation, and same way sodium is also coming inside the neurons, that is intracellular. So positive charge inside the cell increases again. So this is a condition which demonstrates depolarization. So we can see depolarization in excitatory postsynaptic potential, and in inhibitory postsynaptic potential we can see a condition of hyperpolarization. Next, moving on, I have said the difference. So what are the main manifestations of the CNS depression or stimulation? What will happen when you take all these drugs? How does it depress your CNS? Sometimes it might show adverse effects, or it might give the positive effects which is more than the normal state. So it might cause you drowsiness, sleepiness, sedation, hypnosis, disorientation. You feel everything confused, you are in an unconsciousness state. It also might get coma or death in the severe condition. You also might get coma or death in the severe condition. CNS stimulation. How does it stimulate your CNS? It might get you through excitement, euphoria, mania condition where everything looks happy, overacting, like you're hyper for everything. It might cause you insomnia, which is sleeplessness. You might get the tremors, twitching, that is like you might get those jerky movements of your eyes. You might get convulsions, epilepsies. You might be unconsciousness. You in the severe condition, same thing as the depression. It might cause coma or death. These are some of the manifestations of the CNS depression and the stimulation. So this is a general introduction where we studied about the neurotransmitter definition. What are these neurotransmitters? These are the chemical substances which are responsible for the transmission of impulse through the synapse. We studied about the examples of neurotransmitters, inhibitory, excitatory, and the mixed neurotransmitters, and what is IPSP and EPSP. IPSP mainly causes the hyperpolarization, and the EPSP mainly causes depolarization. We also studied about some clinical manifestation of the CNS. What happens when the CNS gets depressed? We feel drowsiness, sedation, disorientation, and confusion. What happens when there is a CNS stimulation? We get excited, we get tremor, we might get insomnia, sleeplessness, and ultimately it can lead to coma or death. So that's the general introduction about the drugs acting on the central nervous system. It's neurotransmitters. I hope you have understood this video. So please do like, share, subscribe, and comment. Thank you.